So I'm a public health nurse, and I've been seconded to work with the Hamilton Family Health Team from the City of Hamilton's Public Health Services. And so I'm working with complex patients who are referred to me from various healthcare providers at the practice. And we work with them to develop a plan of care. I'm listening to what their issues are and really trying to empower them to make the connections to identify what their needs are and how they would like to address those needs, and then taking action to do so. So it's really connecting community services, primary care, and the residents themselves to really provide a holistic approach to healthcare and really make connections and create networks. This is a pilot project, so there are networkers and there are navigators. There are lay navigators, certainly in the States, where we have lay people who are navigating, or we might have unregulated healthcare professionals doing some navigation. But one of the differences with my role is that I'm not only letting people know about resources and programs, I'm also doing warm handoffs. So I'll take a family to an Ontario Earlier Centre and introduce them to the workers there. And often it's that transfer of trust, so that because the family knows me and we've built a relationship, when I bring them to the next agency and we have that warm handoff, they often feel that sense of trust is built quite quickly, and they will often begin utilizing those services much quicker and accessing them much more frequently than if I were to just say, there's this opportunity in the neighborhood, you can access it independently. I found much more success in going with them, and so that's a nice piece of this role. So if I have a client, for example, who I might meet at the community center, she might drop in, she's accessing the food bank there, and my hours coincide with the food bank hours. So while she's there, she might come into the clothing closet that we've created to meet some of the needs of the community members. We might have a discussion about some of her needs, and some of her children's needs, and look to connecting her with recreation services or with other healthcare services. And then she might come into the practice, and when I meet her there, I would be able to have a discussion with her about what are some of her other healthcare needs, and sometimes mental health plays a big role in those needs. So I can then connect her with services that we have within the family health team, whether it be health counseling with a mental health counselor, or it could be around diabetic education with a registered dietitian. And then we might also talk about some of the challenges that she and her children might be facing. So I've had sort of this scenario where I might get a call from a social worker from a school who will say, there's a family we're looking at trying to make a referral to another agency to get more, could be around assessment or intervention. And so one of my roles is to then really help facilitate that conversation amongst the different service providers within the practice, so that we can get those referrals and really provide all of the healthcare, really address all of the healthcare needs and issues within that one family. It's a really innovative project because it's providing collaboration between different sectors in healthcare. So we're looking at public health and primary care, as well as the community. So it's really empowering residents. It's empowering the client themselves to identify some of the issues that they're facing, and then to work collaboratively with the service providers to address those issues.